Hello, everyone. Thank you all for making the time to join us today for number 3 in this month's series on elder justice. This month, we're focused on fraud that is related to healthcare that impacts older adults. My name is Amy Herrera. I'm a special agent at the FBI's Washington, D.C. field office, and very happy to go quickly over a handful of administrative items before we jump into the meat of today's conversation. So first off, yes, we are recording this session. Like all the other series, like all the other sessions in this series, we're going to post it to a publicly accessible website. I'll put the address in the chat box so that you'll know where to find those recordings. You'll be able to find today's recording likely tomorrow on that website. So look for that. Feel free to tell your friends and your family to watch it too if they're interested in this topic. This series consists of 4 webinars in the month of June. We did another 3 webinars in the month of May. This whole series of elder justice is led by 2 main partners, which include the National Capital Region chapter of InfraGard and the Washington Field Office of the FBI. But we've done it in collaboration with a whole lot of partners, both government agencies and nonprofits. And 2 of our co-sponsors are with us today. And that includes the DC Office of the Medicaid Fraud Control Unit and the Senior Medicare Patrol. So you're going to hear from 2 of those experts here very shortly. We do have 3 handouts that are loaded for you today. 2 of the handouts are copies of the speaker's slides for today. So you do not need to take detailed notes because all the things you're going to see, you can just take with you. Feel free to download those handouts while we're in the session today. If you don't get to that today, they will also be posted to that website tomorrow so that you can access them at your convenience. If you have questions, fantastic. We love your questions. As they occur to you, just type them in the question box. We're going to get to questions at the end of today's presentation so that our speakers have time to get through the content that they've prepared for you. The more questions, the better, because if we don't answer your question today, that's what the session next week is all about, to answer all the questions that we ran out of time to address in the prior sessions this month. So as you have questions, type them in. If we can get to them today, we will. If not, we'll get to them next Wednesday. If you're a member of the media and you'd like to write a story about what we're talking about today, fantastic. Please just reach out directly to us through the chat box or the question box, and we'll connect you with the appropriate public affairs folks who can assist you in that mission. If you're attending today to earn continuing education credits, we are not offering those directly ourselves. However, tomorrow you'll get an email that confirms your attendance at today's session. Also in the email will be a certificate that you can submit to whatever organization typically issues your continuing education credits. So that's how you can get your CEUs for attending today, is by providing your attendance in the form of that certificate to whatever group typically issues your CPEs. All right, I think we have reached the end of the not very exciting administrative part. So yay, now we get to talk about the cool stuff today. Today's session is divided into 2 parts. The first part is going to dive deep into a particular case involving neglect. So that's going to come to you courtesy of our friends at the Medicaid Fraud Control Unit. The second half today is going to talk about a new set of frauds that are all linked to COVID-19. So should be quite the interesting set of facts today. I have the very great pleasure now of turning the virtual microphone over to Jonathan Rich, who is a special agent with the DC Office of the Medicaid Fraud Control Unit. John, over to you, sir.
Thank you, Amy, and welcome everyone. Good afternoon for those folks on the East Coast, everybody else, good morning. I'm with the DC, the District of Columbia's Medicaid Fraud Control Unit. And I know there's a lot of folks that are set up this webinar that maybe elders are working with seniors. And so the best way to describe your Medicaid Fraud Control Unit, every state has it, including the territories, U.S. territories. But the best way, and a simplified way to describe it, what we do, or who we are, is in essence, we're a law enforcement agency with some degree of healthcare oversight, dealing with the Medicaid program. And so that's, of course, it's oversimplified, but that's the best way to describe it. A little bit about me, well, I'm not going to go over that. Let's just, the takeaway is that I've got a lot of experience doing this over the years, really almost 2 decades of working in elder and vulnerable adult abuses, lots of cases, and I love what I do. This is important work. Next. So what we're going to talk about today, in the time frame that I have, is a case that I actually worked with the Washington Field Office of the FBI who also takes elder crimes very seriously, and it's one of our main partners along with the HHS-OIG. And in this case, you see criminal neglect and robbery. I just want to make a note there is that, this case that we're going to talk about, we're going to dig into, is an example. It's over a decade old, so definitely safe to talk about it. There was actually a press release, so there's public information about it. But this case occurred in 2009, was adjudicated and finally adjudicated in 2010. And even though you see robbery, is that like a lot of states, the District of Columbia's statute is finally caught up with things that are occurring in with elder abuse. And one of the, of course, if you folks who follow this, is that elder financial crimes is one of the fastest growing crimes there is, elder exploitation. And so if that case were have occurred today, we would have charged, and that is the U.S. Attorney's Office and prosecutors working that person who did it with financial exploitation of an elderly person. It would have been a felony, but that statute didn't exist then, so the nearest thing that we could use at the time was robbery. And so criminal neglect and robbery. Just wanted to clear that up, because you may think, like, how does robbery involve that in healthcare? Next slide. All right. So before I begin, I want to just throw this out there, kind of rhetorically, but think about this. It's food for thought. Is that if a CNA or any other kind of healthcare worker, personal care aide, a home health aide, but really any other kind of healthcare worker is physically abusing their client, is neglecting their client, is financially exploiting their client, could that be considered fraud? And I really want you to think about that, because none of this is happening in a vacuum. And what you'll see, and hopefully I can demonstrate, is that sometimes you can start a case, and the government may start a case as a fraud and realize that there's abuse or neglect or financial exploitation going on. But virtually the same thing occurs. Sometimes, we started as abuse, neglect, financial exploitation, and discovered as a fraud. And so just food for thought, but I can tell you right now, none of it happens in a vacuum. Next slide. So, and of course, I just said, and so, again, it may be present where there's Medicaid, Medicare fraud exists, kind of a little bit vice versa. And again, none of it occurs in a vacuum. So I can tell you that we do see a lot of that. And folks that may be here on the line that work in investigative units is definitely look, wherever you find one, see if the other exists. Again, there's a great chance that it may be occurring on a fraud case, again, vice versa. Next slide. All right. So the case. So the case that I'm going to discuss, again, it occurred in 2009, was adjudicated in 2010. The DC department, I'm sorry, the DC Medicaid Fraud Control Unit, again, we're within the Office of the Inspector General in DC. Some states they're in the Attorney General's office, et cetera. But in the district, we fall under the Office of Inspector General. And so the MFUCU, that's our acronym, and it sounds weird, but the Medicaid Fraud Control Unit, MFUCU received an allegation, a referral from the DC Department of Health in this case. And what it basically said in essence is that there was an elderly gentleman who was receiving services from a home health aide. He had a lot of care issues. In fact, he, if I'm correct, I think at the time he actually had a foot amputated. He just had a lot of health issues. And so he really medically needed someone to be at him. He was in his own home and he wanted to stay in his own home. And again, so he had a home health aide that was caring for him. And what happened, what he reported was that he suspected that his home health aide was stealing his money while she was caring for him in his home. And in this case, actually, we ended up realizing that there was additional evidence that he was able to obtain before he reported it to the government. Again, she was stealing money from him while she was providing personal care. And again, the Medicaid Fraud Control Unit took lead on this case, the MFUCU. And what we discovered in this case is that our victim didn't want to believe that his aide could do that. He was missing money in his home, and he just couldn't think of who could have been doing it. Like a lot of seniors, folks come visit, et cetera. He lived home alone. And so it was just a little bit of money he had on his nightstand and so forth, but over time, and in his drawer, but over time, he just realized that money was missing. And so again, he didn't want to believe that the aide was involved. So what he actually did was able to get a camera, a recording camera. Now we have technology. You have the Nest cameras. You have so forth that you can set up and record inside your house. And what he did, he took the initiative. He wanted to resolve to find out how his money was missing. And so anyway, he installed a Nest camera. I'm sorry, this actually wasn't Nest. It was actually very similar, but it was inside of a device. I think it was a clock or something. And what he was able to discover, because again, he was an amputee, he had a lot of health issues, is that the aide actually was stealing his money from him. And so he was able to turn that information over to the government. And then we started a deeper dive investigation to find out what was going on and so forth. Again, the victim, he's elderly, he has a lot of health issues. And the reason that, so it starts out, this is, we first look at it, we're thinking of theft. And so that's a local crime in the District of Columbia. Again, it's prosecuted by the U.S. Attorney's Office, but it's a local crime. But where the FBI gets involved is that, as the teams, the Medicaid Fraud Control Unit is investigating this, what we quickly discover is that the aide isn't who she says she is. And so one of the things that we were able to do, I interviewed the aide a couple of times. The aide considered to be audio recorded during the interview, non-custodial, which means she's not under arrest, she was free to leave at any time. And we kind of prodded that. And what we realized in this case is that the aide eventually, after I think the second interview, just once she was confronted with information, did admit to stealing money. But another part of the case, which brought the federal government into it, is that what we discovered by looking at records and talking to the aide is that she was actually using someone else's identification. She actually paid someone to use their credentials. And this is not we've seen cases like this before where people have these fake credentials, particularly home health aides, for some reason. And I think it's because they're not licensed the same as CNAs and LPNs, et cetera. But someone had, I guess you can call it renting. The best way to describe it is for profit, allowed her to use their healthcare credentials, their CNA training, their CNA certificate, their name, and all their identifiers to gain employment. And so you have someone who's now hired as a home health aide, but had no legitimate training whatsoever. And again, wasn't even who she said she was. And how does neglect come in there? Is that, as I told you, my victim in this case, at the time the crime started, and it happened over a series of months, this money missing, is that he had, I think, one of his right foot, left foot, but he was an amputee. But during her care, it actually got worse, and they had to amputate even further. And so if you think about it, and there's so many good aides out there. Again, if I ever got, that was a lot of years, so I've ran into a lot of CNAs and aides I've interviewed in cases, not necessarily suspects, but just information I have. And I know that there's a lot of great folks that work in healthcare. And if I ever got sick, I swear, there's so many I would be like, please take it. You're the kind of person I would want. And so I don't want anyone to take away from this is that, I'm in any way demeaning those folks. So that's the frontline work. Your CNAs, your home health aides, your PCAs, they do very important work to keep seniors like my mother in her home. And so, but in this case, though, is that this aide is providing care where she's not trained. She wasn't trained about anything about wound care. And I'm not saying some of the training is extensive, but I am sure that PCAs and home health aides get enough training to be able to identify and report things up the chain of command, up to the nursing, et cetera. And so in this case, the suspect didn't have that. She had none of that information. And so, I mean, and that's where the neglect comes in, because again, he did suffer injuries from that. So again, the scheme, FBI gets involved, great working partners. We're able to, sometimes these are like a rabbit hole in the sense that there was a lot of moving parts. There were a couple other players in this who, banking transactions can show that every time the suspect got paid, she's sending money to someone. And again, that's that to use their credentials. And so they're able to follow that lead and so forth. And again, as I posed to you earlier, is that if someone's, there's billing being generated all the time that she's there, she's not qualified to be in a position. And she can't give him adequate care, not the kind of care that he needed, that his doctor expected he was going to get. And so, but yet they're billing for that. Now, another part of this, which was interesting in this particular case, is that What we also discovered, again, we got a lot of records in this case, including the suspect, and I'll just call it suspect, let me say her name. Well, you'll see later on, there's public information there. But what we discovered when we got the records is that there was a degree of willful ignorance. And what I mean by willful ignorance is that, that's that saying, old folks say, like, growing up, turn a blind eye. One of those. It's when you see something and you don't want to see it, and so you don't pay it any attention or you don't address it. And so we all want to believe is that, and I know I want to believe that in doing my own mother, who's 85, but that when caregivers, come to our homes, we want to believe that not only who they say they are, but they've been vetted, that they've been trained. And what we discovered by looking at these records is that there was no adequate vetting. There's this, if you think about it, since 9/11, you can't get a job at McDonald's without verifying your identity and having some kind of background check. It's just also the American way of life. Everybody expects that. Yet this person was able to gain employment with not a driver's license, but a copy of a driver's license. That's totally violates that requirement. You show a number of IDs. Usually I think I-9 requires 2 forms of ID, et cetera, and they look at front and back and copy front and back. So how could you hire someone with a copy of a driver's license? And remember, I told you all that she wasn't who. She was using someone else's information. So even if you look at the copy clearly, which by the way was a black and white copy, sorry to laugh about it, but I'm just, that's that willful ignorance that somebody clearly was just simply looking for a warm body to hire without vetting, because it's a black and white copy. It wasn't even color. And so even when you look at that, and I, of course, I've sat in front of this person a couple of times in interview, and I'm like, that is not her. And so that the case involved that. So the case involved this little bit of recklessness on the employer's part. And the training records were the same thing. I saw, as you all, if you've dealt with these kind of stuff before, that even though someone has a certificate, a lot of times they'll do some competency-based training or test, at least anyway, and the employer. And I see some of that where it's, there's a fail and yet it's corrected. And so again, the person did not have the knowledge, yet the employer kind of willfully didn't see that and allowed that person to continue to care for our elderly victim. And so it was a real harm. These cases are so important because, and this is why I love this work and I've been doing it so long, is that, the victims are real. This gentleman was, at one point, he had a distinguished career in DC. I won't say a lot because I don't want anybody to be able to build a career here locally. But he, at one point, had a great career, and but yet he got ill. He had these ailments, and he needed help, and so he was a dual beneficiary. We call Medicare and Medicaid, which is how I got involved. But he depended on this, and so this case was so important. We're close with the FBI. They followed that rabbit hole, followed the money, which we do in financial crimes, to go to these other people that are involved, look deeper at the provider who sent her there to work for him. It was a great collaboration in this case. It was a real example of how, to me, how our federal partners, and I know a lot of times, people think of the federal partners as usually looking at the federal dollars and again, the fraud. But again, as I talked about earlier, is that none of this happens in a vacuum. And that case was a great example of how our federal partners can partner with the state units like the Medicaid Fraud Control Unit to help with an abuse case. Because again, because of the current vacuum, there's something else there. And so this was really an important case. The case went on. We actually got an indictment, and before we were going to go to trial, which we had the evidence, so it's like, let's go. But the person accepted a plea offer and was sentenced, and actually did some jail time behind it, rightfully so, because the victim, again, he suffered. He actually had a real loss, and I'll tell you what I'll do. I'll go to the next slide. I'm going to talk about that a little bit more. I'm sorry. Let's go to the next one so I don't jump myself. So thanks. So this is actually a copy of the press release. You can actually find this on and it's from 2010. And it's still on the FBI's website. The link here, if you want it, we can put it in the chat box. But there's actually, it's still on the FBI's website, and it goes over the case. And so what we ended up doing is, again, attempt robbery and negligence. And again, as I told you all earlier, is that like a lot of states, we've updated our laws in the District of Columbia. And since 2016, we've added, we always had abuse and criminal neglect, but what we added was financial exploitation of an elderly person or vulnerable adult, which can be a misdemeanor or a felony depending on the dollar amount. And so if this would occur now, that person would have been charged with elder financial exploitation and neglect. But again, that's this case predated the law changing. But you can look in the press release again. She did get some jail time. This was a great case to show that collaboration between the federal partners, between those folks like myself who do that, those physical abuse and criminal neglect and other kinds of cases involving people, as the victim versus a system, fraud involves the government losing money, et cetera. So great example of that. Amy, next slide. So one of the things, talking to my victim in this case, and again, he was educated before he got ill, intelligent man. And so, he didn't want to, he didn't want to blame or to have the aide get upset with him during this time frame. Like a lot of elders, he had he wanted to stay in his home. Aging in place is so important to this country and to elders, again, like my own mother. And so that's what he wanted to do. He wanted to age in place. And so he needed that in-home care to maintain some degree of independence. He trusted his home health aide was going to provide him the level of care that his doctor said he needed so he could stay healthy. Again, he suspected somebody was stealing from him. He assumed maybe, I think he had paid somebody to do some work in the house at one point. He assumed it was someone else. He just did not want to believe they did it. And here's the big thing, and this is what I think we have to really wrap our heads around, is that, folks like my victim, he lived alone. There were times I think a relative would come out of town and stay with him sometime, but he was getting, I think, 16 hours a day of care. And so he would do the overnight by himself and had, all the, alert devices, et cetera. But the thing is that, he depended on the aide. He was afraid to even confront her with that because he didn't want to be alone. This is somebody who cared for him. Sometimes that's 16 hours. I think she was the main aide. In fact, I think I was a part of it. Is that, he needed that. He needed someone to be there with him, and so he really was afraid of losing that care. And I think that his example, he personifies a lot of elders who are getting care in the community, who depend on those aides and don't want to make those aides mad, don't want to confront them in a way that could cause them to be upset. And so one of the things is, you think about this, we all get folks knock on our doors. I'm hoping nobody knocks on mine now. I'm actually at home now. And so, people soliciting and so forth. And I've had folks come to my door saying they're a utility company. I want to see ID. In fact, I want to see your ID when you come to my door, even to verify you are. And I think that's the thing we've got to do. I teach elders in financial crimes is that, hang the phone up. Don't even answer the phone unless you know who it is. That's the best thing. But if you do have to answer it and, it's anything but who you expect it to be, just say, I'm sorry, and just hang the phone up. It's the best thing. And so I say this similar with folks coming into our homes, is that you have a right to check IDs. I think that looking back, if my victim would have said, can I see your ID, your photo ID, your government ID? The suspect couldn't have not produced it. It would have not been her picture on it. The point is that, and so he didn't know he really had that right to do it. And so I would tell my seniors who listen to this, is you always have that. I don't care who it is coming into your house. If they're coming to provide some kind of government care, you absolutely have the right to see their government issued ID. And then if they have work credentials as well, that shows that they're an RN or whoever it is, if they're visiting, RNs travel and visit through some of the some kind of care you're getting, but you have a right to do it. Also, one of the things too is checking public information. There's a lot of information out there. If you have a loved one that's getting care, or you're getting care yourself, and you're savvy with the internet, most states' Department of Health has information, you navigate through it, but there's called abuse registries. And that is if someone, it doesn't necessarily mean, if they're convicted, in most cases they're on the registry, but sometimes that's a condition of conviction is they can't work in the industry. But some folks also have incidents where it doesn't rise to them losing their license, but they've done something inappropriate. And that would be in that registry. So I would encourage folks to check those registries. Again, they're going to be through the Department of Health in most states. The biggest takeaway is you've got to report this stuff. We all know that in this, elder abuse is so underreported. We're catching up to where we used to be with child abuse in our country. And folks like us that work in this industry, it's important that we just keep reaching out, doing outreach, but also remind elders and those who work with elders is to report it. If something happens, you suspect it happens, report it. You can't go wrong. Next slide. Amy, next. Okay, here we go. So again, every state has these Medicaid fraud control units. Some are limited law enforcement powers. Some are full law enforcement. Some, have, but nevertheless, they still do this important task. They work very close with their local law enforcement partners, their local police, as though I do here in DC. And of course, your field office, wherever you're located at, we're blessed in DC to have the Washington field office, which has a healthcare squad that helps with cases like these. HHSOIG, which is an awesome partner, which actually we're funded by, and again, state and local partners, other partners as well too, but your state and local law enforcement, DC police, wherever you are, I can guarantee you there are officers there who are trained in elder crimes and detectives as well. So takeaway is please report. Okay, next slide. And if you want to reach out to me, that's my contact information. I'm in the nation's capital. If you've never come to visit, you've got to come visit because your tax dollars is going there. Or the museums, it's all free, even the zoo. And so I'd encourage folks to come visit your capital at some point. But I am in the Washington, D.C.'s Medicaid fraud control unit. And it was great being here and seeing everybody.
John, thank you for that great overview of that really important case. As I promised, we are going to transition now from a chronic, kind of persistent sort of traditional healthcare fraud of billing for services not rendered into more current schemes that are related to COVID-19. So our next expert who's with us today is Jennifer Trussell. She's a fraud prevention consultant for the Senior Medicare Patrol Resource Center. She retired recently after 35 years with the federal government, including serving as special agent in charge of the investigations branch at the U.S. Department of Health and Human Services Office of Inspector General. She also served 9 years active duty Air Force, including time as a special agent with the Air Force Office of Special Investigations. Jen, I turn the microphone over to you.
Thank you so much. And greetings to everyone. And as you can see, after 35 years of federal law enforcement, I have failed miserably at retirement. But the reason that I have is because I still find fraud interesting. I still am very passionate about fraud prevention and fraud, certainly investigation of fraud as well. And I hope by the end of this presentation, you will be as well. Next slide. Today, what I'm going to talk with you about, and I'll warn you, it's going to be like taking a sip through a fire hose, but it's interesting information because, it used to be I could play the game that you name the healthcare fraud, and you name the healthcare procedure, and I can name the fraud. But it was very fascinating about how, with the pandemic, we knew the fraudsters were going to come out of the woodwork. Any public health emergency is like a red cape in front of that fraudster bull there. They're going to come after something, and they did in very creative ways. But what I want to break down for you today is, one, I'm going to briefly talk about the Senior Medicare Patrol that I currently do the consulting work for. But what I really want to talk to you about are the COVID-19 fraud schemes that we've seen, the opportunistic fraud, how each little aspect of the pandemic changed the fraud a little bit. I want to talk to you about, I want to throw out the tarot cards on the emerging and future trends that we're seeing here in COVID-19 fraud. And of course, we'll leave you with some resources as well. So let's go on and take a look at the Senior Medicare Patrol. What is the Senior Medicare Patrol? Actually, many of you may be aware of it, but if you are not, it is actually a grant-based program that has been around since 1997. It's administered by the Administration for Community Living. That falls under the HHS, the Health and Human Services umbrella, which, as you know, is a very large agency, which includes Office of Inspector General there for Health and Human Services, CMS, NIH, National Institute of Health, et cetera. There are many agencies that fall under that HHS umbrella, but so does ACL. And underneath that are one of the many grant programs, the Senior Medicare Patrol. Now, every day, your law enforcement fraud hotlines will take hundreds of complaints. With the Senior Medicare Patrol, when someone calls us, we have programs in every state here, as you can see, and also DC, Puerto Rico, Guam, and Virgin Islands. But when those calls come in, individual assistance is provided to the individuals that are calling these complaints in, as long as it's a Medicare related issue. And that could be something like, for example, your number has been compromised. You're suddenly receiving all these back braces on your doorstep monthly. That could be an indication that your number is compromised. So we'll assist through the Senior Medicare Patrol program and help you resolve that particular issue. But the goals are really to prevent Medicare fraud before it even happens. And we do this through public outreach, through fraud prevention education. But when we do get those reports, we also have direct lines to Health and Human Services, Office of Inspector General, who also work, of course, with the FBI partners and other federal, state, and local partners as well. And we get that information quickly. Now, even though the S&P is not taking hundreds of complaints daily like your big fraud hotlines, because of the fact that we are dealing one-on-one with individuals and their issues, it gives a whole new perspective, and it's been very interesting to me. It may be small data, but even small data can tell us big things, and that is why we have a lot of good information for you in this presentation today. Let's take a look at the next slide. As the complaints began to come in, we decided, I actually have been part of the team reviewing every single COVID complaint that the S&P has received. And it began to kind of organically form in buckets. Of course, some of this was the way the pandemic played out. So for example, what was the first thing that everybody was looking for, besides tests? It was pandemic supplies and equipment. Everybody was looking for gloves. Everybody was looking for, face masks, et cetera, and to include your clinicians, your hospitals, et cetera. So we began to see that bucket of pandemic supplies and equipment. Then came, of course, the testing, the treatments, the vaccines, the cures, or the alleged cures, right? Then it branched off into COVID-related medical services as people began getting COVID, as they began getting treatment for it, and even long-term treatment. Perhaps they were being out of the hospital now, but treated at home. Then you'd have the related medical services to that. And then finally, we were even getting complaints about other pandemic-related fraud. We'd have hospitals call us and say, hey, I ordered, hundreds of thousands of dollars worth of masks, and they never arrived. And of course, we had to get them to the right place. The S&P was not the right place for that call, but we took a number of charity scam calls, of health insurance type of calls. So very interesting that they kind of organically came into those buckets. But as we look at the next slide, what those four things have in common is that the driver here was identity theft. And as we looked at that big umbrella of all the fraud that occurred with identity theft, we also then began to see the methods of contact from these scammers organically form into these also four buckets. We initially began to see most of the fraud attempts come in through text and telephone, through the internet, etc. Occasionally there would be mail and print, more like flyers in the mailbox, sometimes a flyer on the community bulletin board. But then where we really began to get concerned is in person. We are always concerned when scammers are going door to door and they get in the door, especially with a vulnerable senior. And many of these seniors, we were all locked down. Everybody was lonely and certainly just looking for any kind of outreach. Boy, that's where we really got into gear and began to work closely with our law enforcement partners, because they were showing up door to door, not just at group homes or assisted living facilities, but individually as well. What also was fascinating to me was the way that robocalls began to morph. Interestingly, at the beginning of the pandemic, robocalls dropped off. You can look at any of the data, FTC, a couple of different places online, and you can see that at the beginning of the pandemic, the robocalls dropped off considerably. Why? Because many of them worked in large telemarketing warehouses, robocall warehouses. And what do you think happened? They got COVID. And so they were down and out for a while, but I assure you that they came back with a vengeance. And when they did, we began to hear things from our seniors, from our Medicare patients that, hey, I got a call and they said that they were from Medicare. The call would go something like this. Hello, I'm Becky from Medicare. Mrs. Jones, I see as a result of your Medicare history that we should probably make you a priority patient for COVID testing. Let's get you scheduled. How does next Tuesday look? Okay, that's great. Okay, I just need your Medicare number. Okay, thank you for that Medicare number. And yeah, let me just get your Social Security and date of birth. So you can see how that went, right? They were really searching, they were doing the phishing, and of course they were using the social engineering. But then it changed. Recently, it's as though the fraudsters are working with information brokers themselves. As you know, if somebody unknown calls you on your phone, you could actually pay a small fee to find out who belongs to that number. You may even be surprised with the information you'll get, but who wants to pay a fee to find out who or who not the robocaller is? But anyway, these robocallers had information, and they used that to defraud the seniors. Here's what we were seeing. Hello, this is Becky from Medicare. Mrs. Jones, hi. I see that you live at 123 Acme Street. Is that correct? That's what I thought. Thank you. And your date of birth is 02/02/1948, correct? All right, thank you. And your Medicare number is da-da-da-da-da. Good. Well, as you can see, I am from Medicare because I have your information. So let's go ahead and get you scheduled for that appointment. And then they began to go on and get the Social Security number or whatever information that they did not have. Oftentimes they had their address, they had their name, they had their date of birth. Sometimes they had their Medicare number. And so we began to see them get real aggressive with that. So let's move on to the next slide and take a closer look at some of the actual schemes. We've talked about, the PPE, the personal protective equipment. The testing scams were very, very interesting. Usually there's two types of testing places out there. The legitimate ones sponsored by your health departments, clinics, hospitals, legitimate medical organizations, and then your fraudulent ones. At first, we began to see them show up on Facebook. And people were falling for this. A lot of times they were in a church or a small, unused small business parking lot. People would see it advertised on Facebook or social media, and they'd be like, oh, I really need to get a test. And so they would go through, they'd get their nose swabbed, they'd give them a copy of their driver's license and their insurance card, and then their email, and then they waited at home and never got their test results. It's because the fraudsters really didn't do a test. They threw all those nasal swabs away. What they were really looking for was a copy of that insurance card and that driver's license to steal. And you normally would be able to tell these things because they would shut down quickly. They might have been open only for a few hours, only for a day. They weren't there the next day. Then they were showing up in, the parking lot of some strip mall. And so we began to see interesting things with the testing scam. Once contact tracing became a thing, remember contact tracers? It's no longer a thing. And so the contact tracers, sometimes people were getting calls from people representing themselves as contact tracers just to try to get their identity information. And when it comes to treatments and cures, comedy writes itself. Seriously, there was COVID curing toothpaste being advertised, COVID curing tea, the supplements, you name it. At one point, somebody was selling a cream that ended up being a illegal pesticide that somebody had put into cream form, and because all these people had reactions to it, I got reported fairly quickly. But boy, we began to see some interesting fraud with treatments and cures. The door-to-door solicitation when the lockdown when things began to open back up really concerned us, as we talked about. People were soliciting door-to-door saying, yeah, hi, Mrs. Jones, your physician has ordered a COVID test. May I come in? And of course, they were just trying to get in the door. You can only imagine some of the concerns that we have the minute the scammer gets in the door. But what about telemedicine and telehealth? interesting that during the pandemic, telemedicine is an amazing venue for healthcare whose time came during the pandemic. Telemedicine was a critical need during the pandemic. Telemedicine, also known as telehealth. But don't think that the scammers didn't take advantage of it. I find it most helpful to take a look at a picture. So let's go on to the next infographic. Here, what I want to show you is kind of a basic about how the fraudsters took a good service, turned it into a bad scam. First, a beneficiary, Medicare beneficiary, a senior would be solicited by the robocall. You know, remember, unsolicited is the key term here. Always be wary of that. By the way, when you answer those calls, even if you hang up quickly, it just puts you back on the list. But anyway, a beneficiary would be solicited by a robocall. And then the marketer on the line, if they actually got you to agree, hi, this is Becky from Medicare. Let's schedule you for a telehealth appointment because of your risk for COVID-19. And then immediately, sometimes it was maybe within an hour, but usually they would just really connect them to a telehealth provider who knows. Maybe they had a stethoscope around their shirt there, but whether or not they were a true provider was unknown. And what they would do is they would ask the patient just a few simple questions. Do you have a family history of any cardiac issues at all? Or, you know, the typical stuff, any high blood pressure, low back pain? And then they would prescribe medically unnecessary, durable medical equipment, the back braces, the wheelchairs, etc. Genetic tests, tens of thousands of dollars in whether it was panels of genetic tests or cardiogenetic tests. We're seeing a lot of that right now related to cardiac. And we're talking thousands of dollars of tests being ordered, or some other service, right? Anything that they could bill for. They would get the Medicare patient's information. Sometimes they would even ask for the physician's information and fax it to the physician who, you know, in a stack of 300 documents they had to sign that day may not have noticed that they didn't order that. And then oftentimes then this was billed by a lab, a telemedicine provider, etc. Sometimes they came after the patient. Most of the time they were hopeful that Medicare would notice and just pay or another insurance. But then that patient information was resold. Right now, if your credit card is stolen, the analytics will shut it down in 3 days. We've all gotten a call. Hey, did you buy a television set 14 states away for $299? Why, no, I did not. Okay, we're going to shut this credit card down and give you a new one. But your Medicare number, your health insurance number can be resold again and again and again. And they are so valuable to the fraudsters. Next slide. Let's continue on with this opportunistic fraud, watching this timeline of COVID fraud as it happened. Then, you know, once things began to open up, it was insurance marketing. Whether it was on the phone or door to door, knock, knock, knock. Hi, this is John, and I am a Medicare sales representative, and we're just doing this as a community service. There's a good chance that your Medicare supplement right now doesn't cover COVID-19. Why don't we get you on a Medicare Advantage plan that may cover that? Sometimes people were talked into switching to a plan that was not better for them and in fact did not have better coverage. Very aggressive health insurance marketing solicitation. We began to see remote patient monitoring. For example, an internal medicine physician would decide to issue Fitbits, you know, this little thing, to all their patients because it has a heart rate monitor on it, and then they were trying to bill for it under what is legitimate remote patient monitoring. If you were hospitalized with COVID-19, you're discharged, but you're still having a lot of lung and cardiac issues, remote patient monitoring, having some devices attached to you that upload the information to your clinician is a verifiable, legitimate medical service. Issuing a Fitbit to somebody just so you can bill for it is not. We've talked about the robocalls and the wellness surveys where they're just trying to get your information or trying to bill you for expensive things. But this is where it got fascinating to me. The vaccine trials, the vaccine surveys, and the vaccine passports. For the vaccine trials, what was fascinating there was we actually got a couple of calls from hospitals that said that there's all these people outside our door talking about a vaccine trial and we're not running one. But what happened is people would get text solicitations or email solicitations that they had been selected for a vaccine trial. And all they had to do, they'd be paid $2,000 for it. All they had to do was enter their bank account information, $1,000 would be deposited after they completed the actual trial, and they needed to report to Acme Hospital the next day in order to be a part of that trial. The other 1,000 would be deposited in their bank account. There was no trial, and usually their bank accounts were wiped out by the time they got there. But what about vaccine surveys? This is the one that still makes me chuckle. We began to get calls. People that got a Pfizer vaccine survey, and then they answered it. It turned into fraud. People that got Moderna, people that got Johnson & Johnson. And I began to wonder, to the fraudsters, is there some giant database of who got what vaccine? And do the fraudsters actually have they kind of hold of that information? Because only Pfizer people were reporting this fraud, this fraudulent survey. And they look legitimate, 10 questions, but at the very end, and I'll show you the comedy about how it was fraud, you can see why. Guys, I woke up in the middle of the night to something besides my snoring husband and realized that the fraudsters had a 33% chance of getting it right. Only people who got Pfizer were, they were just sending out emails and robocalls right and left. But if you got Pfizer and you were being asked about a Johnson & Johnson vaccine, you weren't answering that call. And so indeed, we began to see that. Next slide, let's take a look. You can see here that at the end of that 10 question survey, they would say, you have won an iPad Pro. There's no cost for that iPad, but please just enter your credit card information to pay shipping and handling only. We only have so many left. Enter it now. People would, and their identity was stolen. And so these are actual examples from some of our cases. They, of course, have been sanitized to protect the guilty. Next slide. As I read the tea leaves here about what comes next as we begin to wrap up this presentation, I do want to give you a heads up. Right now, what we're seeing are add-on services, the genetic tests, the durable medical equipment, allergy testing. You go in for COVID testing, you have a sniffle, maybe we ought to test you for allergies, and then they're getting thousands of dollars of allergy tests and perhaps even being prescribed expensive immunotherapy. People are being prescribed physical therapy. Respiratory virus panels are being added to the COVID test. Any diagnostic, anything that scammers and sometimes legitimate physicians who are looking to maximize their revenue are doing as well, who hasn't had an office visit added to their vaccine. But we're worried about the big scammers, the 100% fraudsters there, the identity thieves. Right now, watch out for COVID long hauler treatment. Those with long COVID, suffering with long COVID, don't think the scammers aren't taking advantage of that. But also even free COVID testing sites. I assure you, they're not free. And once again, they may be just looking for that information. They may even ask you telling you that they're paperless and just to scan that QR code on your phone and everything will be uploaded. No, what they've done is just gotten access to everything on your phone. Be careful. Next slide. And so what can you do? Be on the lookout. We call that a BOLO in law enforcement, and I'd like you to learn that term as well. Educate yourself. You started today by just getting a sip through a fire hose about COVID fraud. At the S&P, and I'll show you the website here, link at the very end, we have plenty of resources. We have tip sheets, infographics, videos, links to other COVID-19 resources. For all our media folks out there, we would love to see, we have a number of resources and glad to assist you with that as well. But one of the best things you can do when it comes to fraud is prevent it in the first place. Last slide. So as I wrap up my talk today, guys, do not hesitate to reach out and contact us at the Senior Medicare Patrol if you're a Medicare individual. We've got our phone, we've got our email, and the website where we have our resources there is listed at the end. We also have that listed as a resource in the resources on this webinar today. If indeed your private insurance, call your private insurance. They oftentimes will have a fraud unit that works directly with them. You heard from Jonathan, especially if you're Medicaid or even dual eligible, both Medicaid and Medicare, you can call your local Medicaid fraud control unit. Whatever you do, report it. So as I end this presentation today, I hope that it's a collective snort of disgust with these scammers and that you will help and be as passionate as I am about the prevention and investigation of fraud. Thank you.
Thank you, Jen. Wow, you both entertained us and educated us at the same time. I'm glad I was on mute because my guffaws would have resounded loudly, I think. We do have some questions that are starting to build up in the queue. And again, if you're here with us and you have questions, please don't hesitate to drop them in the box. We'll get to them if we can. John, the first question ties back to you. A couple of different folks asked, what happened to the doctor or the agency or the company that hired that personal care assistant? Did they suffer any consequences for having hired someone who was clearly not qualified for that job?
Great question. And so my task, I still do that now. I was focused on the abuse. I do resident abuse inside the unit was my task. Is so abuse, neglect, sexual abuse inside facilities, financial exploitation involving, again, with a Medicaid nexus, which means it could be in-home care as well as facilities, nursing homes, et cetera. And so the partner that I had with the FBI was focused on following the money on the other aspect, because as I did say, there were some other actors out there that was allowing, but specifically the home health aid company. There was a search warrant executed. We were looking for some of the patterns. Obviously, if you find one thing, there's probably other examples. But that was a separate case, and so I don't. Ultimately, I am not certain what ultimately happened to because there was folks in HR that were involved, et cetera. So, and I apologize for not having that answer. But and the partner I worked the case with is no longer with the Washington field office. If he was, he could answer that for me. But it was kind of like if you think about it, it was like a marathon. I had the baton at first, and I passed the fraud section on to my partner, who followed some additional leads. I mean, we worked together, but he followed that out to Maryland and other places. So the short answer is I absolutely am not certain what ultimately happened to the company. I'm not certain if they were excluded. I'm just not certain. And folks involved, like in HR, et cetera.
Got it. Thank you for that. Jen, next one is coming to you, and it's a question about dementia. So have you found in your work either with HHS OIG or now with Senior Medicare Patrol, if the victim has dementia or has other cognitive functional issues, do you see that there might be a tendency not to take seriously a particular complaint or just not to believe it on the part of people receiving the complaint, if there's some form of dementia involved particularly?
Yeah, that's an insightful question. And I'll tell you, the answer to me is the opposite. We know that those with dementia, with cognitive decline, are targeted by the fraudsters. So when they call in, we give special attention to that, both in the Senior Medicare Patrol and all of the law enforcement agencies do as well. They're well trained in that. The difficulty comes in getting information that is, correct. Sometimes they don't, oftentimes when we're talking with somebody, they may not remember if it was last week, whether it was several months ago. They may not they may not remember many details about that. So you do have to work a little harder. And oftentimes, many times they do have a guardian or somebody that is allowed to speak on their behalf. Sometimes we can work with them. Did they get a package with a genetic test swab in it? And if so, what is the address and return label on that package to help us get a little more information? But the short answer is no. As long as, especially when we recognize right away that they may be someone with a little bit of dementia or a cognitive decline or something in that vein, then indeed we give it more attention because the fraudsters will prey on them.
And next question really is for both of you. So John, I'm going to toss it to you first and then Jen back to you. And this is, do you have any advice for private investigators? So folks who are not federal, state, local law enforcement, but might see some kind of instance of this, what should they do when they come across this? John, you first.
Absolutely. They're such an important group. I left the Medicaid Fraud Control Unit, and at some point I worked at the DC Attorney General's office where I did elder financial crimes. And so in doing that, we've got a lot of reports from bank investigators, for instance, where they suspected that one of their customers, bank customers, an elderly person or a vulnerable adult, may be the victim of financial exploitation. We love getting that. They would send it to Adult Protective Service, et cetera. And so I've actually talked to a lot of them over the years. I can tell you that that is so valuable, whether you work at an insurance company, like a bank, some kind of, annuity, wherever that may be. I think it's important for those private investigators to try to develop those contacts in your local area with those investigators that do elder crimes and refer. I mean, there's been gold mines. There's been cases made because bank investigators, where an elderly person was in cognitive decline and could not monitor that account appropriately. And we've had cases where it actually involved bank employees. I hate to say it, but it's true. Anyway, that was exploiting. There's a case that is a press release of the U.S. Attorney's Office in D.C. involving, unfortunately, with SunTrust at the time. I think they've changed their name, but nevertheless, it's those internal investigators that catch stuff and let the government know that starts great investigations. And so the answer, I'm going to simply say the most important one is report. If you've got a doubt, if you have a suspicion, report. We, investigators don't go knock on the door and say, well, Bank of America said, or whatever. That's not how that works. We just want to make sure the senior's okay and if they're being exploited. So please report.
Jen, what are your thoughts? Same question.
Yeah, and I'd like to mirror Jonathan's thought, but also narrow it down even a little bit more. Kudos to all the private investigators out there, and those usually those are some great tips. In addition, oftentimes they have additional information. The biggest problem I see is you have to practically need an investigation about who to call sometimes, right? So if you are Medicare, okay, if you are investigating and it's a Medicare matter, then indeed you would want to call the Senior Medicare Patrol. We provide the information, or HHS, Health and Human Services Office Inspector General at 1-800-HHS-TIPS, or the FBI hotline as well. If it is Medicaid, Jonathan already spoke about that, you want to call your state Medicaid Fraud Control Unit. That would be the appropriate contact. If it is private insurance, Blue Cross, Humana, United, Aetna, oftentimes there's a number on the back of that insurance card, or you can just get online. And it may even be a private employer insurance, but there's contact information somewhere for that insurance. Contact them and ask to talk to the fraud unit. If it is something that doesn't fall in that category, you have to ask yourself what government agency may cover that. For example, elder abuse. And indeed, you would want to reach out to your state and local authorities that deal with that particular issue. So once again, and want to thank our private investigators out there for forwarding the information. And oftentimes what I find is they're astute enough to know that they need to pass along. Maybe it's an attachment with a that shows the, like I said, the return label of the lab. But that gives us some, that really adds credence to the complaint when we get a little additional information in, as opposed to just a phone call.
Well, it's hard to believe that our time together is just about come to an end already. The time always flies when we get to hear such great, interesting content from experts like this, the two of you. So I'm going to ask each of you for a quick final comment. If you had one takeaway that you wanted the audience to have learned from today, what would that be? John, first from you, what's your takeaway for everyone today?
Yeah, briefly, and I know that I kept saying, report, but crimes against the elderly is increasing. I go to seminars and I see some of the numbers about underreporting, and it's real. There's agencies that are keeping this data, and while I'm not a data person, I can't tell you the numbers. I can tell you that it is increasing, and the fact that it's underreported. And so for the private investigators, for the seniors, for folks who have seniors in their lives, for anybody that's in attendance today, is you have to report this. If there's a suspicion, it's just best let Adult Protective Services, who also works close with law enforcement in district, as well as they work close with law enforcement in Maryland and other states. But whether you put it to Adult Protective Services, again, to your Medicaid Fraud Control Unit or other agencies, reporting is the biggest thing. You absolutely need to make sure these things are reported.
Excellent. Jen, what's your one takeaway for the audience today?
All right, my one takeaway, and I know I got to make it quick, is actually going to be a surprising one. I am asked all the time, Jen, why is there so much healthcare fraud? And while I don't know the answer to that question, I can tell you this. I don't know if there's any more fraud in healthcare than there is any other, segment out there. Think of all the tax fraud out there. I was never a math major in school, but I do remember the 80-20 rule. 10% of the people in the medical field out there are amazing. They have given their life to advance that science. 80%, they are doing the best job they can. And right now they are frontline warriors. Kudos to them. But 10% are losers and chuckleheads and cheats. And those are the ones that we have a passion for going after. And I hope now that you do too. If you remember one thing, is it unsolicited? And if it is, check it out. And if you're defrauded or someone else is that you love or care for, report it.
Great ending words of wisdom from the both of you. Thank you both for spending time to share your expertise with everyone who is online with us today. A couple of quick wrap-up items for everyone. Remember that you'll be able to download the handouts from today on the website. You'll get a link to the website in the email you receive tomorrow. That also will have a certificate of attendance that you can use for continuing education credits when you leave the webinar. And again, tomorrow, you're going to get a link to a 2-question survey. We read all the comments that we get. Please share your thoughts about what went well today and what could have been even better today. And remember that we'll be gathering again next week for the last session in the series that is to address all the questions that we didn't get a chance to answer, including a couple that came in today that we didn't get to. So if you had a question and we didn't get to it, please join us next week, same time, to hear the answers to those questions. Thanks to everyone who is here with us today. Please stay safe, and we'll look forward to the next time we see each other online. Bye, everybody.